I will share my experience basically for last 35 years on TB hip. I was head of the department at KM. So major experiences from KM. So yes, orthoplasty can be done in tuberculosis, active and healed. So if you see the literature, Chandler said there's a great risk. Jupiter says minimum 10 years. Hardin says a long period. Johnson said always some risk. But Kim Young-Ho from Seoul, we had an interaction, and he was the first pioneer who started major work on active TB. So there are many papers on active TB with some reactivation, lot of papers on healed TB. So I have done study, and from my study, I have reported some points. Reactivation of the TB occurs when you are doing active TB. Inadequate selection criteria, I'll come to that. Discharging sinus, malnourishment patient, severe bone destruction, frank pus present during surgery, inadequate pre-op and post-op ATT, duration of drugs, it's very important. No effectivity assessment. We keep on giving drugs, but as you know, there is a lot of problem of drug resistance. So this is a major part. Immunological status is very important. Good immunity, I have some parameters. And many times we use streptomycin whenever we use cemented THR. CD4 count is a basic small parameter to understand the immunity of patient, because this is a part of our study, and we have and a lot of literature also available for specific TB and as a parameter for immunity of the host. So it is easily done, and HIV, it has really brought this point very important for immunity status. So we use this as a parameter. So only good immunity, there is a good success for joint replacement, and with good medication of anti-TB medication, effective anti-TB medication, the CD4 count improves. There is a minimum biofilm formation, various articles mainly from spine. I also had an experience of doing frank pus with neurological deficit, and we did a lot of global decompression, implantation, and it was a successful. So there are a lot of papers on spine surgery. So they say that there is a minimum biofilm formation with tuberculous bacilli. Last 35 years, 55 active TB and 78 THR. These are selected patients. I'll come to this criteria. And I was very fortunate. There was not a single case of reactivation. So my protocol was, of course, arthritic stage of hip. Effective is the most important part. Anti-TB, I give an aggressive 5 drug, and then for up to 10 to 12 months. No discharging sinus. Whenever there is a discharging sinus, there are other organisms they enter, and it's like a septic arthritis. So that should be always discarded. You can do 2-stage. At the end of treatment, effectivity is basic 2 parameters I had taken, ESR and C-reactive protein. These are not very important, but these are available very easily, and we get gross some information. So effectivity is decided from the reduction of this, and during surgery, ESR should come below 50, C-reactive should come below 10. These were my criteria. No pus on. Always we do MRI before preoperatively. KZH tissue is accepted. Good immunity, CD4 count should be more than 500. Well nourished, good immunity, HIV negative. We don't operate, no patients are included with HIV positive. No large bone cavities more than 10 millimeter, because these are aggressive and you cannot eradicate the germs completely. No bone lesions away from cartilage more than 10 millimeter away. Hill TB, you need to give post-op anti-TB medication. This is very important because there may be dormant organism which can become active. So you have to give post-op anti-TB medication. And streptomycin is very useful whenever you are using cement, local streptomycin powder. I was invited as a guest speaker for British Orthopaedic Association at 2004. One of the topic was TB. This was 2004. I have a presentation in 95, and this was one recent presentation 2021 March on Journal of Orthoplasty, one of the largest series published series on active TB. Hill TB. Now I'll go to some examples. Now this patient was operated outside 25 years ago. It was a TB case. They did joint replacement which failed, and they have to salvage the joint by doing excision orthoplasty. They could not remove the cement, and patient 25 years, there's so much of overriding, limping, some pain, and came to us. We planned it, reconstructed, completely removed the cement, and it was stable, painless, minimum limp. And this is 5-year follow-up. Is quite stable. Active TB, few cases. Very important. We always give 3 months of effective anti-TB medication. And few example, classic, you can see, looking at the symptoms, clinico-radiological, you can diagnose. Some patients we have done biopsy, not each and every patient. So this is 11-year follow-up, and you can see on the right there's a bone formation superiorly after some time, 11 years. I think walking is the best stimulus to form bone, and that's a natural stimulus, and if the stability is good, bone formation always occurs. One more example, classical, he was a policeman, inspector, and you can see 15 years activity, protrusio type. You can see a active TB MRI also shows after good effective anti-TB medication. You can see there's a good reconstruction, 19-year-old follow-up. There's a complete reconstruction of the acetabulum, and she is 19-year-old follow-up. Active TB, there was a fracture, he came with a fracture, and he was already a TB hip on anti-TB medication, and he just while getting up developed a fracture. So I call it as a pathological fracture. MRI showed some activity. That was an X-ray before fracture. And this is 18-year-old follow-up, cemented hip, and everything is healed. Mortar and pestle type as per Dr. Shanmugasundaram's classification. Classical active TB, and 16 years post-op, she's got a very good activity, reconstruction with the bilateral is very rare. This was a post-miliary TB, and you can see well demonstrated activity, and both hips done, and this is 16 year post-op. Wandering acetabulum, this is again a CT guided base confirmed diagnosis, and you can see classical wandering acetabulum, and 7-year post-op, excellent reconstruction. For the defect we have to use a trabecular metal, which is one of the best metal support which forms bone. Sometimes there's a involvement of the spine, and you can see this young girl, 15-year-old, 19-year-old girl with spine with nil neurological and hip involvement. She was almost bedridden, and after surgery, everything with after 3-month anti-TB, you can see 2 years, 9 years, and 14 years activity level and So 14-year-old follow-up. Progressive destruction of the head of the acetabulum, 19-year-old boy, and reconstructed. So in conclusion, good immunity, effective anti-TB, these are the key factors. Heal TB, you have to give anti-TB medication post-op, and active TB only selected, no draining sinus, no frank pus on MRI, pre-op 3 months minimum. Sometimes we have to give for 6 months if the effect is post-op 10 to 18 months anti-TB medication. Good immunity status, CD4 count should be 500 before, when you plan the surgery. CD4 count improves with effectivity of the anti-TB medication, and no lesion away from the articular surface. Arthroplasty can be safely performed with above criteria. Thank you.